A potentially major breakthrough for the 6.5 million Americans aged 65 and older living with Alzheimer's.
This is an all too real situation for so many families. Researchers say an experimental drug called Donanemab appears to be better at slowing down the disease compared to Leqembi, which was approved by the FDA earlier this month.
And the news was revealed at the Alzheimer's Association International Conference. Dr. Ian Smith, a physician and New York best-selling author, says several 100,000 people could benefit from it and qualify to use it. But like any experimental drug, there are some concerns here. So let's bring in Dr. Ian, a friend to the show here, to weigh the pros and cons. Good morning, doctor. Always good to see you. This new drug is not a cure for Alzheimer's. I think that's important to point out. It's only slowing the progression of the disease by 35% compared to Leqembi, which showed 27% slower progression. How significant of a breakthrough is this?
Well, good morning to you both. Yes, this is extremely significant. Once again, it's experimental, so it hasn't been approved yet. But if it does bear out, it could be very significant. It's showing that there's a 35% slowing of the progression of the disease compared to 27% with Leqembi. The other thing, though, it's also showing an important number is that if you administer the drug early enough in the disease process, that you can slow it down by 60%. That's a huge number. Something else important, by the way, is that in this particular drug, Donanemab, when they stopped administering the drug, there still was a benefit. So they stopped, people experienced the reduction of the plaques. Amyloid plaques are what you see in the brain. It's this clumping of protein. When they administered the drug, these plaques actually went away. And they stopped giving the drug because the plaque content had become so low, and they still had benefits. So there's a lot to be excited about with this new drug, Donanemab.
Well, you've obviously written tons of books, but in terms of a study that's this size, 1,700 people participating in this year-and-a-half-long clinical trial, is that a large enough sample to prove that that's going to be effective for the majority of Alzheimer's patients? And when would it be available, if so?
Yeah, it is a large sample. And so the numbers are good. So we're excited about the numbers. Something like this, it's still experimental. It has to go through the FDA process. They may fast track it, given how good the results are. But I have to caution, there are some side effects. They found that some people had brain swelling. Others had bleeding on the brain or brain hemorrhage. And 3 patients in the trial actually died. So as with all drugs, there are some side effects. But it seems right now that the benefits outweigh the side effects.
Okay. And I know you were just mentioning this works on the plaque of the brain, which really seems to be a hallmark of the disease. When you talk about slowing, down the progression of this by 35%, I think a lot of families want to know, what kind of time does that give my loved one back? I mean, are we talking 6 months, a year? What does this mean in terms of time for these patients?
Sure. Well, the way they're measuring, the metric they're using is not time of how long they will live, to the end of the day. The idea is the quality of life. Will they be able to slow down the symptoms that patients with Alzheimer's experience? Loss of memory, loss of ability to do daily functionings like eating, cleaning, going to the bathroom, losing directions. So what it shows is that there's a great potential that people who have started this kind of what we call cognitive decline, it can slow dramatically possibly and allow people to have a more normal life for a longer period of time.
And that's something that every family who is struggling with a loved one who has Alzheimer's desperately wants. A major breakthrough, something that could certainly shift a lot of families' futures. Thank you so much, Dr. Ian, for joining us.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.